Hello everyone, my name is Christian Diaz and I'm going to talk about empagliflozin and progression of kidney disease in type 2 diabetes. Definition: Type 2 diabetes is a serious condition where the insulin of your pancreas can work properly or your pancreas can make enough insulin. This means your blood glucose levels keep rising, diabetes confers an increased risk of adverse cardiovascular and renal events.
Chronic kidney disease, CKD, is a progressive condition that leads to end-stage kidney disease and eventually death. While CKD primarily affects kidney function, it also increases a patient's risk of cardiovascular events. In fact, patients with CKD and type 2 diabetes, T2D, are 3 times more likely to die from a cardiovascular event than patients with T2D alone. Approximately 374 million people have type 2 diabetes worldwide. Up to 40% of these patients also have CKD. In patients with CKD and T2D, 3 major categories of pathophysiological drivers promote CKD progression. Hemodynamic factors, like increased blood pressure. Metabolic factors, like elevated blood glucose. Inflammatory and fibrotic factors, like pro-inflammatory and pro-fibrotic proteins. But one of these is unaddressed by the current standard of care: inflammation and fibrosis. In the kidneys, the mineralocorticoid receptor, or MR, is a key trigger of inflammation and fibrosis. Under normal conditions, MR signaling regulates electrolyte and fluid balance within the kidneys. The MR may become pathologically overactivated under certain conditions, like type 2 diabetes. In patients with CKD and T2D, pathological MR activation in the kidneys is believed to be due to increased expression of the MR and its activators, which leads to the production of pro-inflammatory and pro-fibrotic proteins, inducing inflammation and fibrosis within the kidneys. Renal inflammation and fibrosis gradually cause thickening and hardening of the glomeruli and injure the kidney's tubules. Over time, inflammation and fibrosis may lead to a progressive decline in kidney function, increasing the risk of end-stage kidney disease and cardiovascular events like myocardial infarction or stroke. Because all 3 categories of drivers contribute to CKD progression, all 3 should be addressed in order to alter the course of CKD in type 2 diabetes.
Application of medicine. In the Empowered Outcome trial, empagliflozin and sodium glucose transporter 2 inhibitor reduced the risk of major adverse cardiovascular events in patients with type 2 diabetes at high risk of cardiovascular events. We want to determine the long-term renal effects of empagliflozin and analyzing. There was a specific component of the secondary microvascular outcome of that trial.
The Empagliflozin study was a study testing the efficacy of empagliflozin in patients with diabetes. And for the first time after 25 years, we have a drug that showed a reduction in mortality and morbidity. But not just overall mortality, but also the occurrence of new heart failure cases. This is very important because of the safety concerns that we had with previous drugs, like the glitazones or some of the gliptins. And therefore, the results of the Empagliflozin tell us that we have a new class of drugs that can be safely used in patients with heart failure. Of course, there are new trials ongoing to address specifically the efficacy of the SGLT2 inhibitors in patients with heart failure. And the results of these studies will be important, not just to confirm the results of Empagliflozin, that seems to be also mirrored by the interim analysis of the other trials with the SGLT2 inhibitors, but also to teach us how to use friendly these drugs in patients with heart failure. One important point is that now cardiologists are empowered to treat diabetic patients with heart failure. We shouldn't leave diabetes to other specialties, and the guidelines specifically say that patients with diabetes should be supervised by a cardiologist.
Pros and cons. Pros: improving hyperfiltration in patients with type 1 diabetes. These effects may translate into improved renal outcomes. Cons: incident nephropathy, defined as a progression to macroalbuminuria associated with long-term adverse renal effects.
The Empagliflozin outcome study was a study designed to assess primarily the safety of empagliflozin in patients at high risk of cardiovascular disease. So the study had a goal of showing that empagliflozin was safe and did not increase cardiovascular risk, but at the same time it was designed to look at whether there would be any benefit of giving this drug to patients with cardiovascular disease. Did it reduce mortality and cardiovascular events such as myocardial infarction, stroke, and heart failure? Patient population were patients with type 2 diabetes who had a hemoglobin A1C of greater than 7%, who also had cardiovascular disease, and that was defined as a prior heart attack, triple vessel coronary disease, or single vessel coronary disease with evidence of provocable ischemia, or they had a prior stroke, or they had peripheral vascular disease. They had to have a creatinine clearance, an estimated glomerular filtration rate of greater than 30, and they couldn't have a body mass index of greater than 45. Empagliflozin is a sodium glucose cotransporter inhibitor, and it blocks the uptake of glucose by the proximal tubule in the kidney. So it blocks both glucose and sodium uptake there. So it increases glucose, it causes glycosuria. So the patient passes glucose in their urine, and it's the glucosuria which the excretion of glucose, which results in glucose lowering and glycemic control. They're quite powerful agents. In fact, they lower blood glucose more than the DPP-4 inhibitors, for example. So the use of these agents is in all patients with type 2 diabetes who have adequate renal function. So they have quite a wide application.
Issue applied in Ecuador. It is necessary to make health professionals and patients aware of this new risk and inform them so that they take the necessary measures to prevent them from appearing, since information has spread that non-traumatic amputation is more risky, especially for the tooth, and the use of these antidiabetic medications to treat abnormalities, severe case of diabetic ketoacidosis, and acute renal failure. The conclusion: in patients with type 2 diabetes at high cardiovascular risk, empagliflozin was associated with slower progression of kidney disease and lower rates of clinically relevant renal events. Than was a placebo when added to standard care. Thank you so much.